Hello, my name is Dr. Gail Roboz. I'm the director of the leukemia program at Weill Cornell Medical College in New York City and the New York Presbyterian Hospital. I'm also a member of the MDS CRC, or Clinical Research Consortium, and I'm very glad that the title of this video, "Don't Throw Science in the Garbage," got your attention. You can check out much more information about the participating members of the MDS CRC on crushmds.org, but the objective of my video today is to talk to patients, family members, loved ones, scientists, anybody working on MDS about the importance of correlative or translational scientific studies on the blood and bone marrow of patients with MDS. I think it comes as an incredible shock to many patients to realize that after their routine blood test is analyzed, the rest of the tube of blood might get thrown in the garbage. In my view, that's potentially throwing science in the garbage. MDS, a complex bone marrow disease involving red blood cells, white blood cells, platelets, the bone marrow microenvironment, and lots of complicated signaling that results in the correct functioning of that factory, is actually undergoing a bit of an explosion in understanding and knowledge based on a lot of new technology, which has allowed us to learn much more about this disease. The bone marrow, the factory that drives your blood cell production, is a very complicated organ. And it used to be that all we had was looking under the microscope, looking at blood cells, chromosomes, FISH testing, and a few other parts of the science laboratory, things like immunophenotype and counting up blast cells or early leukemia cells to try to figure out how a patient was going to do with MDS. But now, in the last several years, with the advent of next generation sequencing technologies, which many patients know about from the front pages of newspapers, we know that some patients with MDS have acquired mutations that not only might tell us more information about what's going on with a particular patient's disease, but eventually we hope this will lead us to an era of what we call precision medicine or personalized medicine, in which the specific mutations that a specific patient's MDS might have could lead us to selecting better therapies. Actually, though, we don't fully know what we're doing yet in terms of guiding patients based on their mutations to a specific MDS therapy. And there are worldwide efforts, including in the 6-member institutions of the MDS Clinical Research Consortium, to try to profile as many patients as we can using blood and bone marrow specimens to see how specific therapies and specific mutations that individual patients may have can help us in treatment decision making. So, if you're at one of our participating institutions, or actually at many academic centers across the United States, and you're asked whether we can use your blood or bone marrow specimen for research studies, please encourage yourselves, your family members, your loved ones to say yes to that request. Because without doing the additional laboratory studies, specifically in the realm of mutation profiling, we're not going to be able to answer the questions that patients need to know the answers to. Well, if I have an ABC or a DEF or whatever the mutation of the day is, which therapy is better for me? Unless we make the correlations between patients, their mutational profiles, the rest of the features of their MDS, and the outcomes of treatment, we're not going to be able to answer these questions. Most of the time, studying the blood or the bone marrow doesn't actually involve an additional procedure for the patient. This is blood or bone marrow that has already been taken as part of a routine sample. It would just otherwise be discarded. One of the major objectives of CRUSH MDS is to correlate among 6 major academic centers, not only the clinical information about patients, how old you are, how many siblings you have, when you got this disease, what you've been treated for so far, but also what the scientific profile is of your blood and your bone marrow samples. And because it's not a common disease, if we combine studying patients from these 6 major institutions, we hope to get answers faster. So please consider not throwing science in the garbage.